Tonight, she's just 29, and she's already had 30 cosmetic procedures. Breasts, nose, lips, brow, and wants more. Wait till you see what she's done with herself. You're not going to believe it. Jenny Lee, addicted to plastic surgery and taking your phone call. She's next on Larry King Live. Jenny Lee is our special guest tonight. An incredible story. She's only 29, just turned 29. She's already had 30 cosmetic procedures, including breast implants, lifts, a brow lift, cheek and lip implants, 3 nose jobs, a liposuction, and is contemplating more surgery. At the bottom of the hour, we'll be joined by Dr. George Pratt, a famed licensed clinical psychologist from La Jolla Scripps Memorial Hospital, and by Dr. Robert Singer, the board-certified plastic surgeon. Both are distinguished in their fields. I guess what people would say is, you weren't ugly, were you?
No.
Okay. You have beautiful eyes.
Thank you.
Nice shaped face, right? You're very slim. You have a nice body, etc. You walked in, you're very pretty. What do you need this? I mean, really, what do you need this?
Well, I just think it started a long time ago, and, you know, once it's ingrained in your brain and it's been beat in there, it's really hard to get it out, and you just continue to self-examine yourself and put yourself under the microscope, and you know, I think if you're told something enough over and over again, you begin to believe it.
So we're joined now by Dr. George Pratt, PhD, Linda, licensed clinical psychologist. He's chairman of psychology at Scripps Memorial Hospital, La Jolla, California, and author of Instant Emotional Healing, Acupressure for the Emotions. Dr. Pratt, clinically, psychologically, what do you make of this?
Well, I think that she has a lot of personal strengths, that spirit and the determination and the enthusiasm. The dilemma is, I think she's carrying around some pretty severe baggage that has contributed to the BDD. BDD usually starts in adolescence. It's when kids get teased or made fun of. Then they have a heightened awareness of something that then kind of sticks with them.
So it started like with their breasts, and people complained that they made fun of too small. Or...
Yeah, and also you said that up until the time that you were 17, you really didn't have anxiety, and actually you had never thought that there was something wrong with you. So one of the pivotal pieces was the relationship you were in with someone telling you that everything was wrong with you on a rotating basis. It was almost like almost a cultish kind of behavior, kind of wearing you down and then being emotionally abusive. And then just hearing it constantly, that would take a toll on anyone. So that can set an imprint, even running both a conscious and a subconscious program. There's something wrong with me, I have to fix it.
So when she looks in the mirror, she sees flaws.
Correct.
Yet I was just looking at her profile. She has a great profile. So I would say, what would you change in her? Now, how can you, what would you want to help her? Does she need help?
I think so, but perhaps you don't. In terms of the kind of the desperate attempt to always be doing something, I think there's more to life to enjoy life than to be so focused on the physical. I think it's never ending. I think it's better to fix low self-esteem, even if people would think, heck, you don't have low self-esteem. But part of this is related to that. So if you work on that and become the person that you're capable of, I think the intensity of some of these other feelings, they're going to decline.
Jenny, what do you think of that?
Well, I agree with him, and you know, that's, I think, part of the reason why I wanted to pursue, you know, acting, is because I get the times that I have worked, I've gotten a lot of enjoyment and fulfillment out of that, and it makes me feel really good. In a way, it's probably some sort of therapy for me, just to, you know, to do that kind of work, because I just absolutely love it. But, you know, I've also practiced lots of the cognitive behavioral therapy stuff that I have learned. And
is that working?
It's working. It's working.
You don't know about cognitive therapy?
Cognitive behavioral therapy is the standard. It's a wonderful tool. Sometimes it's a little bit like bending steel. It takes a lot of time and attention. Sometimes, because of what had happened to you with the emotional abuse over actually several years, let's think of it this way. We can logically come up with some conclusions, we'd agree to them, and then we'd seek to follow them, but let's say for some reason we can't. We're blocked in some way. If you have been traumatized, you can't get the prefrontal cortex, those two little dinky spots right there that really are associated with logic. You can't get them, you can't get that logic to the parts of the brain that really need it, the limbic system. There's a disconnect, so you have to find alternative ways to get that information in there indirectly.
By the way, Dr. Pratt, I'm told that while 1.5 to 2% of the population have body dysmorphic disorder, about 5 million people, it was never included in the Diagnostic and Statistic Manual of Mental Disorders until 1987. Why?
I think underreported, people didn't want to deal with it. People thought it was really, practitioners thought it was more associated with obsessive compulsive disorder.
Is it a disorder or a disease?
You know, technically, you know, I think we're splitting hairs. It's a
something wrong.
It's a condition that can be debilitating and disabling for people.
Could you change her, Dr. Pratt?
If she wanted to be changed. I don't think there's enough surgery to fix low self-esteem through that method. I think the capacity with interest and motivation to actually help heal this, I think that does exist. Along with the traditional techniques that Jenny was talking about, the cognitive behavioral desensitization of the anxiety and the obsessions. Along with that, adding some additional tools. Clinical hypnosis can be very helpful. Eye movement desensitization, reprocessing can be helpful. And then the newer innovative techniques on energy psychology, where you actually affect the body's energy system.
She'd have to want it.
She'd have to want it.
Okay, Dr. Pratt, if she doesn't think there's anything wrong, is anything wrong?
Well, it's an operational definition, defining what's wrong. I would say that if you have a person that is normal looking to begin with, and then is excessively preoccupied about appearance, so much so that 12 invasive procedures prior to age 28, you know, something's going on. There is a self-esteem issue. There's some kind of a connection or a self-absorption in the process that is distancing her from other opportunities in life. And
problem is, can you work with her while this is going on? Because if a psychologist is working with her, she's going in at the same time to get plastic surgery.
Yeah, that'd be a lot to do at one time. I think a lot of what you're experiencing is resulting from those years of severe emotional abuse.
But shouldn't she be over that now? She's
wrong.
with a marriage that's
We have a
happy.
conscious mind, we have a subconscious mind. People can be minimally consciously aware of something and can still be stuck in the subconscious. When you clear that, it's a different story, and that's one of the things we do. And it makes a big difference. I think you've been subjected to probably 3 or 4 years of intense negative self-hypnosis, and you started believing the horrible things that were being said about
And
you.
so there's
You
still
liked your body before this started, then he was picking on your feet, nose, buttocks.
Feet?
But it was never ending, and it was a rotating series, a sequence.
So he implanted.
Right, and then also the self-esteem issue of associating. I mean, I know some of the complexity. I mean, it wasn't an easy situation to deal with, but you want to make sure that you're treated with respect and love, and that you do the same thing with yourself.
Right.
Dr. Pratt mentioned something that you could do.
I found it would be interesting to actually treat you for some of the trauma you have received, some of those blocks that you had mentioned earlier. And even though you're not forced to change your behavior, it's almost like taking some of the fuel out of a rocket ship. And so the orbit changes by itself. And actually, that's a pretty easy thing to do with some of the newer
Really?
techniques, yes.
Dr. George Pratt is Chairman of Psychology, Scripps Memorial Hospital, La Jolla. Tomorrow night, Linda Hamilton. The subject is depression. Rod Stewart on Saturday. Colin Powell Monday. Robert Downey Jr. next week. And Sharon Stone.